with regards to our nursing homes. So of that 104, 24 are associated with the nursing homes. The 3 new deaths today that we're reporting are a black female in her 70s with underlying health conditions who passed away on April 26. A black female in her 70s with underlying health conditions who passed away on April the 10th, and then a white female in her 90s with underlying health conditions who passed away on May the 2nd. And as we work to save lives and stop the spread of COVID-19 in our community, many Houstonians are also coping with the reality of job losses during the public health crisis. As you know, last week, City Council passed a $15 million rental assistance program using a portion of the $404 million the city received through the CARES Act. And earlier today, well, starting last week on Thursday, the portal opened for apartment complexes, and then earlier today it opened up for tenants, for renters. The program administered by Baker Ripley opened at 10 a.m. this morning, remained open for about 90 minutes, and received enough applicants to exhaust the entire amount, that entire 15 million, and it was exhausted in 90 minutes. More than 11,000 renters applied today and met the pre-screening eligibility requirements. That's more than 11,000. And last week, around 6,000 landlords signed up to that part of the program. So it opened up this morning at 10. By 11:30, the entire $15 million had been exhausted. I knew going into it that the need would be greater than the amount provided. That is why last week I sent a letter urging the federal leaders to commit at least another $100 billion to rent relief and $75 billion to homeowners being foreclosed. What we dealt with today, we dealt with renters. We're hoping that Congress will do something, at least allocate $75 billion for homeowners. And Bill Kelly, who oversees the Government Affairs Department, is working directly with our congressional partners, and Bill is right there in the University of Houston bandana. Last week, Recovery Czar Marvin Odom announced a COVID-19 response plan focused on testing, access, and equity, and expanding the health department's workforce to hire an additional 300 contact tracers. Today, I'm pleased to announce the Houston Health Department is hosting 2 virtual job fairs to increase our workforce to monitor and contain COVID-19. Please bear in mind, we already have 125 contact tracers who are already working. We're seeking to add another 300. There'll be a virtual jobs fair that will be taking place this week. The Houston Together Virtual Jobs Fair, that's how we're labeling it. The Houston Together Virtual Jobs Fair on the screen will take place Thursday, May 14th at 11 a.m. and 1 p.m. on Microsoft Teams. People interested in participating should visit the City of Houston Human Resources webpage Thursday morning to find links to join the virtual events. And the job fairs will provide information on 300 new temporary positions, including how to apply. Available positions include contact tracers, call center representatives, community involvement coordinators, epidemiologists, nurses, and other roles. Houston Health Department Stephen Williams is here to discuss more about the work the contract tracers will do, especially as more people are returning to work. Director Williams.
Thank you, Mayor. Today, the mayor announced that there was 117 positive COVID cases. What that means for the Houston Health Department is that we have to contact all 117 individuals. That one contact usually results in 3 to more contacts. The whole idea of contact tracers or contact investigation is to ensure that we get an informed history of close contacts of the person that has tested positive so that we can conduct an intervention that would lead to those individuals being safe. The 300 new temporary positions that we are advertising for through our virtual job fair are critical to this contact tracing effort. The mayor said that not only is that contract tracing piece important, but we also need people to man our call centers for testing. We need community involvement coordinators that will help us to engage the community to get folks really comfortable with the idea of being contacted by the health department. This is not new for the health department. We've been doing this since the early inventions of public health, but it's never been to this scale or to this scope. We've already had a few dozen people call or contact the health department expressing interest in these contact tracer jobs or related jobs, but that's not enough. The 112, even plus the three additional 3 dozen is not enough. We need another 300 people to ensure that we're adequately following up with people who have tested positive for COVID-19. And to that end, I just want to give you a little update about our testing efforts. We've used both internal resources from the Houston Health Department and community partners to strategically guide locations to ensure equity and adequate testing penetration across Houston. Our 2 major sites, Butler and Delmar stadiums, to date have tested more than 30,000 individuals. Our partners, United Medical Center, Memorial Medical Center, is also operating a variety of fixed sites, testing sites. Those sites are guided by geographic information received by the Houston Health Department to ensure testing penetration and equity. An added strategy is our mobile testing sites. Current mobile sites are operated by the Houston Health Department and the National Guard, sponsored by TDMS. They have been rotating throughout Houston, and we plan to cover at least 25 locations by the end of May. These sites can see anywhere from 100 to 150 people per day. And the estimated capacity between our mobile sites and our fixed sites is around 2,000 per day. We want to thank our partners, Kroger, who's going to be a future partner, United Memorial Medical Center, Spring Branch Community Health Center, Lone Star Circle of Care, El Centro de Corazon, Avenue 360 Health and Wellness Center. These are FQHCs that we have been supporting in our efforts to test. Our testing situation is fluid. We continue to modify our plans as we continue to gather information regarding testing penetration in individual zip codes and health equity.
Thank you. And the goal is to have testing all over the city, as we indicated, 24 to 25 sites, testing sites by the end of the month. And we are well on the way to doing just that. I will tell you that in the city of Houston, there are a number of people, great demand for the testing. I went and had mine done on yesterday, still waiting on the results for it. But let me encourage people to continue to be tested. And before I open for questions, I want to mention that Phase 1 of the Mayor's Office of People with Disabilities Food Access Program has ended as of last week. In collaboration with our community partners, we were able to serve nearly 3,300 Houstonians with disabilities. And the Mayor's Office with Disabilities is working with community partners to stand up a more long-term food security Phase 2 for the duration of the COVID-19 pandemic. And if you want more information, please visit www.houstontx.gov/disabilities. Before we turn directly to the question, let me bring up Tom McCaslin, Director of Housing Community Development, to speak specifically about the Renters Program and maybe can elaborate a little bit further on what happened today.
Thank you, Mayor. As the Mayor indicated, with our partner Baker Ripley, the portal for the tenant applications opened at 10 a.m. Applications were a little bit slow because of capacity for the first 30 to 45 minutes, but that real quickly got up to speed, and within the hour and a half, the first 90 minutes, all 50 million was fully allocated. Over 11,000 applicants came in, as the Mayor indicated. The total number looks like it's going to be close to 12,000, over 11,800. And prior to the opening of the portal, we know that 30,000 folks were on the website looking at the resources that were there. So we know that the need far exceeds the $15 million, which is all the more reason to push for the additional federal resources that the mayor mentioned. Over the next 2 weeks, Baker Ripley will be confirming these applications. Within 2 weeks, the applicants will receive a pledge letter, and the goal is to have all of the funding out the door and into to the landlords on behalf of the tenants by the end of the month.
And then because we have some inclement weather coming in over the weekend, it does appear, a significant amount of rain, Chief Bunick with the Office of Emergency Management.
Great. Thank you, Mayor, for your leadership and for your guidance during this COVID responses. The Office of Emergency Management has been actively monitoring the weather along with the COVID responses for the city. Last week I was talking about hurricane preparedness week. Today I'm going to talk about a potential large storm that's going to be coming in this weekend. Right now it's expected to come in the Houston area late Saturday and early Sunday. We're expecting potentially heavy rainfall, which will likely lead to street flooding. The Office of Emergency Management has been preparing with the other city departments, the Houston Fire Department, Houston Police Department, Public Works, to ensure that we have all our high water rescue vehicles and personnel on call. So the city is prepared. We're going to be closely monitoring. I will tell people, if you are out and about and you do see high water, turn around, don't drown. The mayor's office will be providing messaging along with the Office of Emergency Management to alert Houston to keep everybody informed. Thank you, Mayor.
So please be weather aware and weather alert. And I wanted to mention that on the weekend with the weather expected rain. So if you desire to be tested, and bear in mind anybody in the city of Houston can be tested, whether you are symptomatic or asymptomatic, try to get in between now and Saturday afternoon or so, because if the weather gets too bad, we may have to cease the testing later on Saturday into Sunday. So hopefully not, but do try to make you get your authorization code and go in and be tested. And let me tell you, it's not being tested. It's not bad at all. You either do the self swab yourself, or you just kind of lean back and close your eyes and let the other people do it. They told me, I was going to be able to do it myself, and I was real happy with that until they got me to the testing site, and the nurse told me to lean back. She was going to do it, and she went a little bit further than I would have gone, but be that as it may, I got it done, and I feel so much better that I got it done. So I do it the same, and then, of course, if you have any questions, Chief Bunick is here with the fire department as well. We'll take any questions that you may have now, if you have any. What did I say? Chief Pinion. What did I say? Did I say Bunick? Oh, okay.
All right, thank you, Mayor. I have questions from several outlets, starting
Sure.
with Houston Public Media. They're asking about the rent relief program, and is the city tracking how many people have visited the sites, and are you concerned about what's going to happen next with so many people unable to get that help they were trying to apply for?
And the answer is yes, and I'll let Tom elaborate even more. At one point in time, we had over 17,000 people, either online or on the phones, trying to get in. At one point, it was well over 17,000. That's why at the very beginning, in that first 30 to 45 minutes, it was a little slow. People may have thought the system had crashed. It wasn't that the system had crashed. It was just that the system was just being overwhelmed with calls. And so we cut it off when we got to a little more than 11,000, 90 minutes in. So it started at 10 o'clock. At 11:30, we just cut it off because we had more applicants, that was going to exhaust the amount of the money that we had available, the $15 million. I would tell you, if we had kept it open, there would have been thousands of more who would have been applying. We simply cut it off because there was just no more money there. So an indication that there is a tremendous need across the city. And to give you, give you some more, I alluded to it earlier, But just for the apartments or the landlords who were providing units, rental units, we had more than 6,000 landlords apply, more than 6,000. So if you know if you just got landlords applying, and each one of them have a number of tenants, then it was going to be huge. So at the end of the day, it was close to 12,000 who did come in and got pre-screened, and then we'll make the assessment to see what the actual number will be. But I suspect it will be a large number.
And staying with the rental assistance program, the Cron was asking if Congress doesn't give Houston any additional funding for this, will the city be able to provide any help to renters?
That will depend on once we assess all of our needs. For example, Director Williams has already put forth the cost of a program dealing with testers and contact tracers and all the component parts. That's close to $200 million of the 404. $15 million was used in this rental program. That brings you down to 185 left. And then we're taking a look at the firefighters, police officers, and other city employees that have been redeployed for COVID-19, and we'll make an assessment of how much we can draw. At the end of the day, there will be PPEs. I forgot about that. So we will have to continue to purchase a large quantity of PPEs because this virus is still here. In the end, we will have more needs that exceed the amount of dollars that we've already received from the federal government, from Congress, and the Federal CARES Act. I'm glad to see Congresswoman Sheila Jackson Lee has just arrived. The hope is that we will have more additional congressional funding, federal funding will come down. But specifically as relates to the rental assistance program, hopefully there will be a stimulus package for renters. That will help out quite a bit. We used $15 million from the Federal CARES Act. We could have easily have used $100 to $200 million, easily.
All right, a few more questions here from the Cron. Councilmember Plummer said on Facebook she couldn't get herself tested anywhere in the city of Houston before finding River Oaks Hospital. Did the city not try to facilitate a test for the council member?
I did not even know that she was feeling poorly. Okay. I did not know about her situation until somebody told me after she was tested. She announced it. Did not know that she was feeling poorly until she announced it. So just like the other council members and staff, anybody can be tested at any of the public sites. There is no cost. You don't have to be symptomatic. You can be asymptomatic. And if you're affiliated with Cigna, like most of us, many of the city employees are, you can go to Cigna. Steve, you want to answer that question? If people want to be tested?
As the mayor was stating, all of the sites that we are either operating ourselves, which would really consist on a mobile unit, or we're supporting, like the UMMC sites, are free. The major sites, Butler and Del Mar, we're really asking people to utilize those if they want to be tested, because the process itself is relatively easy. We in the health department also operate a call line, and if people have issues regarding testing or accessing testing, they can actually call that number. I have personally intervened in certain situations to ensure that people get tested that want to get tested.
So let me be as clear as I can, whether you're a city employee or not. If you want to be tested, you can go to Butler Stadium, you can go to Del Mar, you can go to the testing site at Houston Community College South on the Southeast campus. You can go to any of our testing sites free. It doesn't cost you anything. You don't have to be symptomatic. And that's for city employees or anyone else in the city of Houston.
This next question follows right along with that from the Cron. Do you think the city should be providing city hall staffers with these tests instead of referring them to these other sites or their own physicians?
Well, and quite frankly, if you're a City of Houston employee and you have Cigna, you can go to Cigna. I mean, you can go to Kelsey-Sebo.
All right, and this next one also from the Cron. Amid the 3,000 furloughs of city workers, will you or any of the staff be taking pay cuts?
Well, 3,000 are being furloughed. That is a pay cut.
But you personally or your staff members, you're not taking pay cuts?
I don't anticipate it.
I believe that's the last from the Cron. Check here. Telemundo is asking about the $1.41 per month charge for trash collection. It appears like a small amount, but they say, don't you think this will add to hardship for low-income families?
Well, what will add to a hardship if, for example, if the city is not able to provide the bins to pick up people's trash. And what will add to the hardship is that if you don't do it, and additional people have to be furloughed or laid off. Those are all hardships. We're all in this together. And the reality is that we're not doing any water disconnects for residential consumers or businesses in the city of Houston. We are under a revenue cap. The city of Houston is operating in a very lean fashion. And so I can stand before anyone in this city and tell you, we are not wasting your dollars. We've been operating with a very lean system. And just like people have to take care of their households, so does the city of Houston. It is what it is. I wish it would be different. But it puts, I think people have seen the budget that we have put forward, and the numbers are not pretty, but we do have to balance our budget. Those are the realities. And just like people have to do it with their households, we're having to do it with the city of Houston.
All right, and one more question here. The city fireworks for the 4th of July, do you know yet if they're still going to be on?
We are looking at a modified Independence Day celebration. We do not anticipate it being the same as the last year. By virtue of COVID-19, it will be different. We're trying to work that out. Just like high school graduations and college graduations are having to be modified, so will big celebrations like the 4th of July.
Thank you, Mayor.
Sure. Okay.
Since I'm here, I'm asking the questions for KPRC. So we'll start. Got a few phones in my hand. After Councilmember Plummer tested positive for COVID, what is the city doing to test staffers and council members as well as disinfect work areas? Has any other city employee tested positive this week?
Let me just say that all of the workstations are being disinfected, just like Councilmember Plummer's office was there, and the chamber were disinfected. That was already done even before we met on Tuesday morning. And all of the different departments and buildings and facilities have been disinfected, and that's happening on a regular, ongoing basis. Again, any city employee can go to any of the public testing sites and be tested free of charge, just like any Houstonian in the city of Houston. They can do that. And then at the same time, if you're a city employee, and if you your health care provider, for example, is Kelsey-Sebo, you can simply go and see them as well. But if you're asking whether or not we're bringing anyone specifically here to City Hall, I think if you end up doing that, you need to take them to all of the places where City of Houston employees are. And so we're not going to treat anyone any differently, so to speak, if they want to be tested. And I encourage people to be tested. I got tested. I didn't go here. I went to the testing site. The testing site did not come to me. Social distancing at your workplace, then those employees will continue to work remotely. So every department director is assessing their situation and their work stations to see whether or not you can engage in social distancing. And to the extent you can't, then those employees will continue to work remotely. There will be no parades, for example, in the city of Houston in the month of June. And so we're not moving forward there. I don't feel comfortable doing that at this point. But we are almost every single day, we are looking at the data and talking to medical professionals to see where we are. But I am uncomfortable with saying that city pools will open up by virtue of the fact that it's very difficult to engage in social distancing and control that environment. So it is unlikely.
Certainly. And this next one, Is there a concern that the positivity rates have plateaued or the line is flat, the curve is flattened, but have not gone down?
Well, certainly has flattened. I think we've blunted the progression, but people are still being tested positively, and there's people who are still dying in our city. And so, for example, we announced 117 cases today. I think it was 150-something on yesterday. 1 death on yesterday, 3 deaths today. So it's flattening, but the numbers of positive cases are still going up. And so until we can see whether the number of people who are testing positively, that number is going down and staying down, not going up and down, but going down, then, the work is still not done. And quite frankly, until there's a vaccine, then we still have to do certain things. The washing hands, proper hygiene, face masks, facial covering, social distancing, all of that's important. And then bear in mind, 117 cases, we are ramping up our contact tracing. And so our job is to talk with each one of those individuals who tested positively to see who they came in contact with, and then is to isolate, quarantine, and treat. And until we are able to do that with every single person who tested positively, then we haven't met all the matrix where you can say, okay, we can move forward. So there are a number of things that need to take place: testing, the contact tracing, keeping a good close watch over the capacity within our healthcare delivery system. Once we can check each one of those boxes, then even though people are tested positively, we can still manage this virus. And that's all we're trying to do at this point, is manage the virus. There are certain hot spots, and that's like our nursing homes and our jails. Those are the 2 major hot spots that exist.
And this last one's related to that. A lot of viewers have written in, Houstonians, just feeling a little antsy about the return to work, the return to gyms, et cetera. The curve is flattened, but what's the message now that they're still home? What do you say to them?
Well, I would feel a little antsy too, okay? And the reality is just that we need to be very cautious on how we move forward, very measured in how we do it. And if you go, let's say, into some place and it's crowded and you see people are not engaged in social distancing, and if you go into some place and they don't have on their masks or face coverings, then I think you might want to take a look at someplace else. Now, with respect to restaurants, you certainly can't eat with the mask on. Okay. But the question is, are people social distance in such a way that you feel comfortable? And I would say to anyone, if you don't feel comfortable, then that should be a sign. If you go, for example, and if you go someplace and everybody is crowded up and nobody has a mask or face covering on, I would not feel comfortable and I would not stay in that setting. Okay? So it's exercising some common sense and recognize that this virus is fueled by closeness. Okay, so this is one time where operating separate and apart is the greatest degree of affection. Okay, but if you don't care much for me, then get close enough to me without a face mask on, then I'm gonna say you don't particularly like me. Okay, so if you like me, put something over your mouth and nose, and then stay a little bit away from me.
So essentially, just a point of clarification
Sure.
here. The message when the goal was to flatten the curve was to stay
Yes.
home, and now the message is?
The message is those very same things that work to flatten the curve are the very same things that will help us to open up and move forward. Okay? Don't change. We've been very successful at how did we flatten the curve in the city of Houston such that we are not having the same number of cases positive and the number of deaths as other major cities. What did we do differently? We started early, we shut down early, we engaged in social distancing, we put things over our mouth, and we engaged in proper hygiene. Those were the things that helped to blunt it. Since the virus is still here and we don't have a vaccine, the very same things as we start to open up that will work well, social distancing and putting on the face coverings. If you act like the virus is gone, and you just come out and you're going to the parties and you're engaged in groups and gatherings and you don't have the face coverings and you're not engaging in social distancing, the virus is going to remind you that it is still here. Where we are now, we flattened it, blunted it. Now we simply have to manage it until there's a vaccine. If we do that, then I think we can manage things successfully. Thanks. The Congresswoman is here. Congresswoman, did you want to make some remarks?
Thank you, Mayor. As the mayor said, we are all in this together, and we will be victorious by working together. I think it is important to take note that the models that we're now operating under in Washington are 147,000 dead Americans with over 3 million cases, and now we're at 82,000 deaths. So the mayor gathered the members of Congress a few weeks ago in the backdrop of the reality that even then, that the coronavirus was not going away. We are even more definitive that the coronavirus is not going away. The tragedy is that it seems to be morphing in many instances, particularly as we are trying to discern what is happening to children. So I think the word to the wise is following what has been the framework that the city and county has used. That is to safeguard most, if not all, of its residents that are here. And I support the idea, not only from hygiene of washing your hands, but also knowing symptoms like your temperature or cough or you can't breathe. That was the earliest symptoms that we were asking people to assess, and if you couldn't breathe, call an ambulance. And now we've added, as we have learned the science and how it propels, to wear masks. And unfortunately, we're in our neighborhoods and we don't see people wearing masks. And so it is clear that as much as leadership is here, if we don't work as a team, wear our masks, and pay attention to the hygiene standards, we're not going to be able to keep it blunted. The mayor, in the meeting with members of Congress, talked about the issues that were important to the city. We listened, and we have been in conference calls, virtual meetings. We have submitted our request over the past couple of weeks. And so I think it's important to note that the next 48 hours, I expect and hope that all of the Texas delegation, Republicans and Democrats, will respond to the conference call that we had and the understanding of some of the needs of all of the cities and counties throughout the state of Texas. So we will be voting on a $3 trillion plus stimulus package, but as it relates to our cities, it will be $1 trillion coming across the nation to local, state, city, and county. And one of the things we argued for and have received is that the city will get direct payments. We argued vigorously for it to be more than just the number of COVID-19 deaths. One death is too much, but some areas had more deaths, tragically. And we mourn those deaths. I've heard the mayor say often, one death is too much. We have people dying here every day. But our numbers, I would say, thank God, we've been working on to try to ensure that we are continuing to move forward to not have as many deaths, but it goes up and down. But it should also be based, this funding, on lost revenue. And the large events that this city, rightly so, and county, had to close or stop so that we could save lives. So there'll be $1 trillion to provide for direct payments. And this bill is called the HEROES Act. And we hope those direct payments will help with our city workers, including our municipal workers, who are essential to helping this city run. Environmentally, no one would want trash around. To our police and fire, to our healthcare workers, EMS, to our teachers, and in particular, we're adding a $200 billion to help in hazardous pay. We are aware of the loss or the infection of a Metro bus driver. Transit workers will be included in that. Many of us made a request for. We are continuing to be a partner with the city by adding a $6,000 addition for cash disbursements to families. And that will come in a variety of ways that will include the children in that family as well. And that we're going to continue the $600 unemployment that will help the mayor and those who cannot find work. Job fairs are continuing. The Texas Workforce Commission has indicated they will not be putting their job search requirement in at this time, but people are frightened. People have child care issues. Some are COVID-19 positive. We will continue paying $600 a month to those unemployed up until January 2021. We are focused on our small, tiny businesses. And so we'll add another $10 billion for our tiny businesses and for faith institutions, because we think those are mostly the ones that have been left out. And we will give you a payroll retention tax credit as well to keep those employees, maybe the restaurants who've opened up, and maybe the business is mounting in terms of takeout, which is personally what I encourage, to build up on the takeout, but I do know that people are excited about being able to be in the restaurants. To keep employees, we will be, in essence, providing more opportunity to be able to keep those employees. Mayor will be helping with your efforts, and we will be giving housing assistance to renters directly and helping people with their mortgages so that they're not foreclosed on. You will be able to get that, and we will plus up the supplemental nutrition program to help with the food insecurity. This should be a bipartisan effort. These dollars are needed now. That is why we're trying to get this done before the end of the week. And let me acknowledge and thank the team for the housing assistant, City Council. Hopefully we will supplement and reimburse you for that and help it to grow. Let me thank the Health Department, Dr. Peirce and others, for immediately moving toward contact tracing. We will provide you additional dollars for that. And I hope that we'll be using our local talent to be able to be employed, because they know our neighbors, they know our neighborhoods, they know our cultural diversity, our language diversity, and I think that is very important, and we'll be providing the dollars. We're trying to work specifically to make sure that you can use local persons for the contact tracing. So, Mayor, we had the conference call, we worked, we submitted these requests. I specifically did the revenue loss. Want to make sure it is revenue loss and direct payments, and that will happen, as well as giving you the dollars that you will be able to supplement, I hope, in your budget for some of those that may be furloughed that are essential workers, and $75 billion again for testing. And I never close without saying testing sites are open, public-private sites are open, working with UMMC and other private entities. Kroger is starting up. CVS will be coming across the nation. Del Mar and Butler open. Forest Brook, Cullen, 510 West Tidwell. Greenspoint is open, and those folk in Greenspoint, we need to see you at the Griggs Elementary School. We have testing. We might be the model for testing in the nation. We have drive-through testing and other aspects of testing. And most of our testing is across the board without appointment and is no charge. And in many instances, no pre-registration. So you can have a myriad of testing opportunities, and we hope that you will take advantage of that. Finally, let me say that we will look forward to working with the city on its issues, and we are particularly concerned, if you will, to make sure that we get these funds here as quickly as possible. And I do want to offer to council member and friend best wishes to Councilmember Plummer and all those who are now facing COVID-19. We want to make sure that you know that we're standing by you and you're not going to be alone.
Thank you, Congresswoman, and thank you all for attending. Thank you very much.